Kia ora koutou katoa. Tōku pepeha mai I te taha o tōku pāpa, ko putawa ki tōku maunga, ko mātātua tōku waka, ko te oreni tōku awa, ko Ngāti Awa tōku iwi, ko nai tai whakae nā te heke kino nei te rangi hauhiri o ku hapu, ko rangi hoia ho hāpata tōku māma, ko Patu Awa Rātahi tōku pāpa, ko Enid Ratahi-Pryor tōku ingoa, ko te tumua ki o te toho te oro o Ngāti Awa, kia ora koutou. Tēnā koe te rangatira mō tō whakarite mō tātou I tēnei rā, kia ora. Tēnei te mihi kia koutou nā pākeke o tēnei marae, tēnā koe tā hereni, tēnei te mihi kia nā, kai whakahaere me te komihana o ngā whānau, kia ora koe whānau, tēnā koutou nā te ropu Māori wahine toku I te ora, kia ora koutou. Tēnei te mihi kia koutou nā hau e whā, tēnā koutou, kia ora tātou katoa. This isn't right. Okay. Welcome to all of you. Welcome to the inner sanctum, to the bosom, to the heart and soul of Ngāti Awa. Welcome to Mātātua Wharenui. Mātātua built as a symbol of unity for our Mātātua iwi, was built at a time when Ngāti Awa was at its lowest ebb, at a time when Raupatu had done its worst to our whānau, to our hapu, to our iwi. Mātātua was built on the hopes and aspirations of our koroua, that one day our iwi would rebuild itself, that the deconstruction of our social, our economic, and our cultural worlds would not be permanent, but merely awaiting another time and place for re-emergence. Okay, next one please. Unlike Jeremy, I need slides so that I don't go all over the motu when I kōrero. So, can I move this so that we can... There we go. Is that okay? Oh, I should have gone to that one. Is that better? Yes. Okay. We have inherited a momoia from our karawa to rebuild Ngāti Awa to its former position of strength. We have today re-established the Mātātua Wharenui and are currently rebuilding our social, cultural and economic foundations. In terms of re-establishing strong, resilient whānau, the journey for many is filled with challenge. The transition from the state of te korenga, from the darkness, after the raupatu, into the state of te aranga ake, where we are prepared and ready to commence the initial journey to self-discovery, has been impacted upon by low health access, low educational achievement, high levels of unemployment, alcohol and drug abuse. In 2009, 1 in 3 Māori tamariki lived in a household below the poverty line. Low levels of income is strongly associated with poor child health outcomes. Tamariki growing up in poorer households are more likely to live in overcrowded houses, have poor access to good nutrition, have worse educational outcomes, higher rates of hospitalisation, and more restricted access to primary health. 1/3 of the Māori population were in receipt of a welfare benefit. I would like to say that that included those of our karaua and kuia who are on superannuation, but it didn't. 1/3 of our whānau are on a benefit because they are either unable to engage and participate in the workforce of this country, or they are physically not able to as a result of sickness. But the point there is if 1/3 of our Māori population are benefit dependent, that will only compound the issues that I have highlighted earlier. One can only expect, without intervention, that 1/3 of the Māori population will increase over time. Similar to Jeremy, I didn't want to dwell on deficits either, but it's hard not to when a portion of our total Māori population is in the situation I've just outlined. 2/3 of our population are doing well. There's the equivalent of Wairaka right there. They are actually moving very slowly, but they're moving. The only issue is you can't tell where those rangatahi are in terms of their journey. Are they still in te korenga? Are they still in te aranga ake? 1/3 of our Māori population are actually transitioning between te korenga and te aranga ake. They're still stuck. And with the sorts of barriers and challenges that are out there, I'm not too sure when they're going to transition forward. 2/3 of our Māori population are more than likely in between te aranga ake, ready to roll, got the goods, and just starting to move forward into te mōhiotanga. Te maramatanga, well, we have those, and we're very privileged to have some of them in this wharenui today. Tāherene is one of the perfect examples in our iwi that we can look to as a person who's actually gone through all of those stages. And he leads the way and shows the way that we can follow in terms of our whānau. To support and work alongside whānau during their journey is the role of Te Tohu o Te Ora o Ngāti Awa, established by Te Runa o Ngāti Awa in 1989 to provide health, welfare and educational services for the whānau of Ngāti Awa and the wider community. We provide services from one site. Apparently, the best services are delivered from one site. I know that for our kuia, they don't want to be going all over town, going to the doctor, then coming back to fill in this paper, then going to pick up the mokopuna, and then go do the immunisation of the mokopuna. It's very hard. The aerial photograph is of Te Tohu o Te Ora o Ngāti Awa, the site that we deliver from. It was a very strategic move in terms of the trustees of Te Tohu o Te Ora o Ngāti Awa to have all of our services located on the one site. A dream some 11, 12 years ago, now a reality. Before we change the slide, this area in front. Many of you would have passed this site. Some of you may not know what was in there, some of you may not care, but a lot of you would have noticed the big clothesline out the front, the big jungle gym. That is the Adventure Solutions Company. It is one of the approaches that have been used by Te Tohu o Te Ora o Ngāti Awa to deal and work alongside our whānau. We use multiple approaches to support our whānau. Te Pahitawa Adventure Solutions is not your usual social and health service agency, is it? It doesn't reek of deficit, it looks quite fun, it looks quite challenging, and all our men love to fish. This company was actually established to provide positive leadership environments that promote and encourage leadership qualities, values and skills. The company provides youth programs, adventure therapy, outdoor adventures, including hunting and fishing, for te tohu o te ora o Ngāti Awa. With the added resource base of Adventure Solutions, we are able to work with youth, not in an at-risk youth environment. Don't you just hate that? At-risk youth. No, no, no. We work with youth in an environment that encourages and promotes their inner self in terms of who they are, the future leaders of our iwi and of our country. To be able to utilise multiple environments of both Adventure Solutions and te tohu o te ora o Ngāti Awa, I get back to the fact that we have to have a one-site environment. That there is an advertisement for our young people. It's not about putting a label above their head of being an at-risk youth. It's not about putting a label above their head that they have alcohol issues, that they don't listen. It's not about that at all. It's about changing the way we think. Jeremy mentioned it earlier. We've got to get away from the deficit model and we've got to start counting in the positive. We've got to start talking in the positive, and that's what strengthening whānau, strength-based approaches are about. Te tohu o te ora o Ngāti Awa, we provide a range of health, social and education services and programs. This graph shows that it didn't happen overnight. Some people think that, oh, look at those ones over there, they've got wonderful resources. It started back in 1989, and here we are in 2012, and we're still trying to build the sort of capacity and capability that is required to work with whānau. Down in the bottom there, in the low, that was the Mātua Whānau service that many of our iwi around here started with. We started taking our own care, our tamariki into our own care, the care of the iwi. That's where we started. And over time, from 1989 across to 2012, we added services, more and more services. Services that together would provide an integrated solution to the very complex issues and problems that whānau we're faced with. Some of the services that are showing, but you're unable to see, because it's not big enough, include, in the red, social services. We added on the yellow bubbles over time, which are health services. And then there's actually a pink in there, which is education. The system that Jeremy mentioned earlier is a system that continues to provide services to Māori in a siloed way. Māori organisations, iwi organisations have the potential to create their own ways in which to work, and this is an example of what that may look like. Just up in the top corner there is an example of one of the programs, getting back to basics. That's kamu pickle. Kamu pickle. Kamu grown from our own gardens, grown from our young people who were in one of our homes, grew the kamu. It was picked and cooked by our queer, a number of our queer, and the whānau who were preparing that were some of our māma who come to the programs. Finding a mechanism such as kai, that's so instrumental in the way we live, is one of the ways in which we deliver services. Delivering services in ways where we can have our queer, our kraua working with our young people to bring about an intergenerational approach to well-being. In the middle, we have a few of our queer who are making a korowai. We also have young people joining in with our queer to make korowai as well. one of the ways to strengthen our whānau again is that whole intergenerational approach. Our young people have never in their lives needed their kaua and queer more than now. And yet, our kaua and queer are very, very busy doing all of the things that Jeremy mentioned. Running our renanga, running the marae. And now, hello, look at us young ones, we want them to run our whānau as well. But that's actually what it's going to take to help our whānau to move forward. And in that bottom photo, you can actually see some of our young mums working with our queer in the kitchen to do something as simple. Now behind all of that, obviously, there's the kōrero that goes on to help those whānau. But when we talk about our whānau, we talk about them in terms of what they can produce, what they can see, and what they can be really proud of. In terms of talking to you today, I really didn't want to talk about our organisation, and I had another presentation to do. But then at the end of the day, it all comes back to the how. Jeremy had 3 ideas in terms of strengthening our whānau. I've come back to Te Toho Toro Ngāti Awa and our structure as one of the ways, not the only way. It's one of the ways in which we can help our whānau. The organisation employs 60 full-time staff. 60. That is a reflection of the challenges that our whānau face. I feel sad when new services are continually added to our organisation. This is an organisation that reflects the social ails of our iwi. And aren't we doing well? All services across the top. The one on the left is the environmental side of the organisation. That is the side where we work with, in particular, the sawmill workers against poisons. We work with the men to improve the state of the whenua. It's called a bioremediation project. And we work with them to also bring to the fore the unwellness of men who are exposed to toxins. So we work on the environmental side, we work on the research side. We also have health services, they're the ones in the middle, going down the middle. Alcohol and drug services are in there. The sorts of programs you'd expect. Tamari ki ora, well child services, community nursing services, asthma programs, diabetes. Because remember, the statistic I didn't quote was we're Māori fit in the scale in terms of diabetes. Well, we're at the top. We need to change the way we eat. We need to change the way we exercise. Exercise isn't sitting on the chair in front of the TV. So again, we've got diabetes services. We've got asthma services, as I said, and a myriad. And as I stand here, I'm not actually that proud to be presenting all of the services that we have available to our whānau. On to the next slide. I'll just give you an indication of what sort of staff make up a support system that work with strengthening our whānau. Contrary to popular mainstream belief, it's a very well qualified organisation. The management staff all hold formal degrees. In actual fact, 2 of the management staff hold masters. We have a general practitioner on staff. We have registered nurses, 5 in total. 4 Māori. Now that's a fantastic statistic. 4 Māori out of 5 are in our nursing team. One of them, very, very proud of, one of them is actually a qualified nurse practitioner. For those of you who don't know, nurse practitioners are able to prescribe. A lot of hard work. She follows in the footsteps of her mum, Auntie Putsi. We have 6 social workers, all fully qualified social workers. I'm very pleased I've got 2 sitting in my front row over here. Those 2 social workers were supported in their degrees by the organisation. How do we strengthen, as an iwi, our whānau? We must take responsibility for supporting their education, and we do that. We had the education grant ceremony for Ngāti Awa some 2 weeks ago, I think, and it was awesome. There were some surgeons in there, there were some nurses, there were doctors, there were some very, very clever people. The key is getting them back to working here in the kainga with our whānau. No good being a surgeon in London. Need those surgeons here. We've got non-clinical staff, 14 kaya whina who work alongside our whānau, working in the homes. Early childhood staff. Early childhood is one of the most critical learning periods in a child's life. That's where the foundation stone of learning is laid. We have an early childhood centre with 50 seats. Te waipuna ariki o mātangi reia. But guess what? It's too small. There's not enough room for the waiting list. And yet, there are other early childhood establishments that don't have full waiting lists. I'll leave that with you. Now, return over our page. The wrap up for that one was basically wraparound services. Service must wrap around and support our whānau and work alongside our whānau, not at our whānau. They must work with them, at their pace. It's very hard. I quite like a lectern, but now you can see I'm reading. The next slide, and again, Jeremy crossed on this. In actual fact, everything we have talked about this morning crosses on the model in front of you. That model is a model of Te Pau Mataho. Te Pau Mataho is a model that was developed based on a number of other models. It's not new, but it is a model that drives the organisation. It is a model that we base every single delivery upon, and all our staff must be aware of and practice. The model, as Jeremy mentioned earlier, actually covers tūranga waiwai. Know where you're from, know who you are, because without that, how can you stand and be anything? And yet, as we know, many of our whānau are missing that in their lives. Spirituality, te pau ihorangi. The ability to come into a whare like this and connect. This whare is our whānau. This whare tells the stories of our whānau. And there are some very mean stories. Not mean and awesome, but mean and nasty stories in here. But that is who we are, and that's what makes us up. Te Pau Mataho is all about, when working alongside our whānau, we must appreciate the blood that flows through their veins. For me as Ngāti Awa, the blood that flows through this wharenui. The tūpuna represented in here represent my history. I have history of violence. I listened to Hone Harawira on TV the other night, where he talked of Māori being a warring people. Absolutely. The stories in this wharenui tell us that. We have it in our blood. Our whānau have it running through their veins. We need to harness that. There is always an opposite to violence. There is an opposite to war. It's about how do we harness those elements and use them positively. Māori are full of positive, strong elements. How do we bring them out? Organisations like Te Toho Te Oro o Ngāti Awa are one of many, trying to find their way through the challenges that our whānau are also experiencing. Oh, next one. Mātātua, built as a symbol of unity for our mātātua iwi. It was built at a time when Ngāti Awa was at its lowest ebb, at a time when Raupatu had done its worst to our whānau, hapu and iwi. Mātātua was built with the hopes and aspirations that one day our iwi would rebuild itself, that the deconstruction of our social, economic and cultural worlds would not be permanent, but be merely waiting for another time and place for re-emergence. Ko Ngāti Awa te toki, te tangatanga I te rā, te nohe I te wai. It was their time, it is our time. Kia ora tātou katoa.